Hi, I'm James, and this is a quick overview of how to access funded support as a neurodivergent university student, including what Disabled Students Allowance, DSA, is, how to apply, and alternatives for students who aren't eligible, like international students and apprentices. For more detail, check the links in the description. I was diagnosed with ADHD at 23 and autism 2 months after starting university. Before that, I'd never received support for either. I was also diagnosed with depression and generalized anxiety at 14, but again, I'd never had formal support. So, when I started university, I had no idea what DSA was, or even what I might find helpful. Students with neurodivergent conditions, including mental health, can access funded support from the government. The types of support are grouped into 4 categories, which include number 1, non-medical helpers. These are roles like specialist mentors for autism, ADHD, or mental health, and study skills tutors for things like dyslexia or ADHD. Number 2, equipment and software. This is assistive technology like text-to-speech and speech-to-text software, headphones or laptops. Number 3, travel support. This can include help with travel to and from university if your condition makes public transport difficult or unsafe. And number 4, general support. This can include consumables like ink and paper if you need to print things regularly. If you aren't eligible for DSA, like international students without settled status or apprentices in paid roles, you're still entitled to support. Universities are legally required to make reasonable adjustments under the Equality Act, and that includes support for neurodivergent students. If you would be eligible for DSA as a home student, your university should offer in-house support instead, like specialist mentors, study skills tutors, or access to assistive software. If you're not offered in-house support, even though you would be eligible for DSA as a home student, speak to your student union advice team or equivalent. If you're an apprentice, your employer has responsibility to provide adjustments, and you can apply for access to work, which is a different source of funding. Your university should have a disability or wellbeing team, the names vary, with advisors who can help you complete your application. As a warning, there can be delays, especially at busier times of year, so the process can take up to 4 or 5 months in some regions. What does the process look like? First, you'll fill in a form. This is part of your initial UCAS application, but if you've already done that, you can fill in a DSA-1 form from the Student Finance website. This includes providing evidence. It can be a diagnostic assessment report, a letter from your GP, previous education, health and care plans, or an occupational health report. Second, you'll book and attend a needs assessment. That's an appointment with a study needs assessor who will ask about the impact on your studying or working at university. This is often offered online, but you can have in person if you find that easier. Third, your assessor writes up their report and sends it to Student Finance. Once it's approved, you get a DSA-2 report, which says what your study needs are, what support will be funded, and recommendations for what support the university should provide. Last, you'll be contacted by the supplier to arrange your equipment and training. You should also share the DSA-2 report with your university to get your other support set up, like non-medical helpers. DSA expects the university to provide some things, like a quiet place to study, so you might not get noise-cancelling headphones unless it's for another reason. This also includes some types of non-medical helpers, like scribes, readers, library support assistants, proofreaders, manual note takers, and examination support workers. However, a lot of these are being replaced by software now, like transcription and text-to-speech or screen readers. You'll often hear people say it's best to get your DSA in place as early as possible. That's good advice if you already have a good idea of what you need, but I didn't. I was diagnosed as an adult and had been working for a decade before going back to university. For me, waiting a few months to figure out what I was actually struggling with was incredibly helpful. It gave me an idea of what was and wasn't going to work for me. For example, I was offered text-to-speech software, but personally I find reading much easier than listening, so that wasn't going to help. I print a lot of things out, so they suggested a printer to have at home. But I have executive dysfunction, and I know myself well enough to know that setting the printer up and keeping it working just wasn't going to happen. I asked if DSA could cover my university printing costs instead, and they agreed. They also wanted to give me software and a microphone to record lectures for my notes. But in mental health nursing, a lot of sessions involve students sharing personal experiences, so recordings often aren't allowed. What I've realised is that DSA equipment and software should make it easier to work in whatever way works best for you. It should not be giving you new tasks or making processes more complicated. One thing that can help in figuring out what might actually support you is looking for friction points in how you currently work. That's the things that cause the most difficulty or delay, and focusing on those areas. Like for me, planning assignments isn't an issue. and a bullet point list is infinitely more useful than a mind map ever can be. But turning long sets of notes into more concise summaries takes me hours, and I mean literal hours. I have auditory processing disorder, so making notes and listening at the same time is an issue. But I also have issues with memory, so I can't just not make comprehensive notes, or I'll forget 90% of what we talk about before the lecture even finishes. I usually copy information across from the slides, so I only have to make notes on the new information, but that leaves me with a lot of notes. Recently, I started using an AI summarizer tool to reduce those notes down and to rewrite them in a different way, which actually improves my information processing because reading the information phrased differently helps me understand it. That saved me literal hours, and it works because it fits the way that I already work. Remember, if you already have DSA, if your needs change at all or the current support isn't working, you can always get another assessment to change your support to make it work for you. Even if your past experience hasn't directly taught you what support you need, it can still help spot friction points. Before university, I worked as a carer. The only reading I really did at work was care plans and cooking instructions. It was nothing like university, but the same friction points were still there. For example, I always had to write notes in the car after a visit instead of while I was with the patient, because I couldn't type and hold a conversation at the same time. It's the same reason I find note-taking in lectures difficult now. If you're not sure where to start, try asking yourself, what kinds of tasks used to drain your energy or take longer than expected? And what would that look like in a university setting? Are there patterns in the kinds of things you avoid, postpone, or find harder? And do those show up in assignments or admin? Is there anything that felt manageable before that's now harder, or vice versa? And if you could have made one thing easier in your last job or course, what would it have been? And can you replicate that support now? Once you've got those in mind, try checking out online resources with DSA support suggestions to see what might meet your needs.